Parkinson's disease degrades motor function by depleting dopamine in the brain. For decades, the primary treatment has been levodopa. Once ingested, it replenishes that dopamine, allowing patients to regain fluid control over their movements. However, this restoration is often temporary. A patient may be walking with a normal gait when their body suddenly stiffens, leaving them frozen mid-step. This graph tracks levodopa concentration in the bloodstream over a 12-hour window. The spikes represent the relief following a dose, while the deep valleys show the concentration bottoming out hours before the next pill is scheduled. This is the wearing off phenomenon. These valleys represent unpredictable off periods, stretches of immobility where the medication has simply vanished from the system before the next dose can arrive. Extending the drug's effect isn't as simple as increasing the concentration of each dose. If we look at the upper threshold on this chart, we see the danger of flooding the system. Concentrations that are too high trigger severe side effects, ranging from vivid hallucinations to dyskinesias, erratic, involuntary physical movements. Clinical success requires a way to keep levodopa in the brain longer while keeping the concentration strictly within the narrow window between ineffective valleys and the toxic ceiling. To find that stability, we have to look at the microscopic environment of the bloodstream and the peripheral nervous system. In this vascular channel, levodopa molecules travel toward the brain but are under constant attack. COMT enzymes dismantle levodopa while still in transit. This highly efficient peripheral breakdown ensures a significant portion never reaches the brain. In effect, the body's own natural metabolic disposal system works against the Parkinson's treatment from the moment the pill is swallowed. Entacapone was developed to counter this specific process. It belongs to a class of drugs known as COMT inhibitors. By binding to COMT enzymes, entacapone neutralizes them. This creates safe passage, allowing a steady stream of intact levodopa molecules to reach the brain. Entacapone provides no relief on its own. It is designed exclusively for co-administration. Because this drug boosts levodopa exposure so effectively, the patient's primary dosage usually needs to be reduced within days of starting the regimen to avoid side effects like nausea or sudden drops in blood pressure. Entacapone functions as a drug for a drug, a calculated intervention that modifies the body's metabolism to optimize the primary medicine. This therapy requires strict timing. Entacapone must be taken with every single levodopa dose, a requirement often managed by using a combination pill that contains both medications. Maintaining this balance also means avoiding dopamine-blocking drugs. Certain antipsychotics and antiemetics can directly oppose the therapy, causing a rapid worsening of the patient's motor symptoms. There are also distinct physical markers of the drug's presence. Patients may experience diarrhea, and the medication frequently causes a harmless orange-brown discoloration of the urine. When successfully integrated, the concentration chart transforms. The jagged peaks and valleys become a sustained plateau, keeping levodopa consistently within the safe zone. This smoothed curve minimizes wearing-off periods, bridging gaps between doses to provide predictable, sustained mobility. By selectively neutralizing the enzymes that dismantle the medication, entacapone stabilizes the existing therapy and preserves the intended effect of the primary medicine.